I am very excited for our next guest. We have Wendell Potter on the line, and just to give our audience a little bit of background about Wendell, Wendell Potter is a founder of the investigative reporting group Tarbell, and he is an author, former corporate public relations executive, and journalist. His books include Deadly Spin and Insurance Company Insider Speaks Out on How Corporate PR is Killing Healthcare and Deceiving Americans, Obamacare, What's in It for Me, What Everyone Needs to Know About the Affordable Care Act, that's an ebook, and Nation on the Take, How Big Money Corrupts Our Democracy and What We Can Do About It. Thank you so much for joining us, Wendell. We really, really appreciate you being here.
Well, Sanjeev, thanks so much for having me on.
So I thought we could start our conversation by talking about a recent incident that happened in Boston, where a 45-year-old woman had an accident that I think any of us could have had. She was using the city's subway system, and there was a gap between the platform and the car, the subway car, and her leg got caught when she slipped, and she had such a terrible cut that the cut went all the way down to the bone. And you would think that in an emergency situation like this, that she would be crying for help, but as she was in agony, she was begging people not to call an ambulance. And she said, "Do you know how much an ambulance costs?" And she was weeping, not only because of the pain, but because she knew that she could face financial catastrophe if an ambulance was called to help her out. And I thought that maybe we could talk about how did we get to that kind of a situation, because Wendell, I know that you also shared the story of another young woman, Natalie Sarkeesian, whose story took place in December 2007. And I feel like we should compare and contrast, these two stories. But maybe you can tell our audience a little bit more about Natalie so that they can get some background.
Well, sure. Natalie Sarkeesian was a 17-year-old girl who came into my life the last year of my job at Cigna. I was head of corporate communications for Cigna. And I'll never forget that case. I'll never forget Natalie, although she and I never met. The call came in from a Los Angeles reporter wanting to know why Cigna was refusing to pay for a liver transplant for Natalie, that her doctors had approved. A liver was waiting for her for the transplantation. It was a perfect match. The parents arrived at the hospital on the day of the surgery, but instead of waiting for the surgery, they were pulled aside by the doctors, who told her that they hadn't gotten clearance from Cigna. So consequently, they couldn't go forward with the surgery. Well, the parents were just dumbfounded. They knew that their policy covered transplants. They didn't know what role Cigna played in this. And they found out that a medical director 2,500 miles away, who had just reviewed some paperwork that her doctors had sent to him, had decided that, in his opinion, the transplant was not appropriate for Natalie. So they couldn't go forward with the surgery unless the parents came up with the money for it, and they didn't have that kind of money. They decided to take the story to the media, and that's how I became aware of this. I started getting calls from reporters, and it became an avalanche of calls from the media as the family was able to generate a lot of media interest in this case. Ultimately, the company realized, in fact, I brought it to the CEO's attention, that the company was on the verge of having a real PR black eye as a result of this denial. So the company decided to, after days, to go ahead and cover the transplant. Well, I was very, very happy, of course, because I am a father myself. I could just imagine what the family is going through. It turned out, though, that so much time had passed between the original request for the transplant and when Cigna finally came around to changing its mind. She got sicker and sicker to the point that she was no longer eligible for the transplant. Her other organs began to shut down. and she died just 5 hours after Cigna decided it would reverse course and pay for the transplant. We call that a horror story where I used to work. That was what we referred to as also high-profile stories, in which someone who had not gotten the care that they felt they were entitled to would go to the media or to a lawmaker, and then I would usually be brought in on the case. And I just didn't have it in me. I had handled a lot of these over the years, and I could just no longer do these. And I decided to turn my notice in a few days later and left my job. There were a lot of reasons that led up to that, but that was the straw that broke the camel's back.
And for our audience, if they're interested in learning more about Natalie's story, I would highly, highly recommend going to tarbell.org, where her experience and Wendell Potter's experience as a PR executive at Cigna. It's all in a chapter of his book Deadly Spin, an insurance company insider speaks out on how corporate PR is killing healthcare and deceiving Americans. It's a really difficult read, just because this young woman had already fought her way through leukemia, had gone through a bone marrow transplant, and needed this liver transplant in order to survive. And there was every indication that she was going to make it through this next fight, had it not been for this insurance company. And so, I bring up these stories of Natalie and the Bostonian woman because there's a common villain, there's a common problem to both of their stories, and that is the insurance industry. And Wendell, I was wondering if we could talk a little bit more about how we, as Americans, are being told that we need to have more skin in the game. But in Boston, you have a woman who's getting skinned alive, literally, by a subway car, and she's more worried about her financial health than her physical health.
Right. Absolutely. And I'll just go back to the Natalie case just briefly. I think most Americans have little idea about how corporate executives are really making life and death decisions. They say they don't, but they absolutely do. When you're making a decision on coverage, you often are making a decision as to whether someone lives or dies. And that was certainly the case with Natalie. And a corporate executive in Pittsburgh decided on Natalie's faith and her let me put that again. A doctor in Pittsburgh decided Natalie's fate in Los Angeles. And so people don't really realize how much these companies actually, to one extent, have death panels. They can actually decide whether someone lives or dies, even if they have health insurance. This case in Boston was another reason why we need to understand the role that insurance companies play, even if you have insurance. One of the reasons I left my job was because I was expected to be a cheerleader for high deductible plans. And this was a industry-wide strategy of moving more and more people into these plans. Today, a high percentage of Americans have high deductible plans, and they simply cannot get the care that they need because of all they had to pay out of their own pockets before their coverage will even kick in. And another problem is that ambulance services are often not covered. Even in an emergency, if an ambulance service is not within a network of an insurance company, you may be faced with full tab of that ambulance. And increasingly, insurance companies are contracting with private private ambulance services. So you often don't know what company the ambulance might come from and whether or not it would be covered by your insurance.
Yeah,
so,
and
that's another reason. Yeah.
And it's such an absurdity, isn't it, that you have to know, like what, I mean, like it's an emergency, like
Yeah.
just by like the nature of the word itself. It's not that
Right.
you have a choice about where you're going to have an emergency and where that emergency is in relationship to the network that you have signed on for with your insurance industry. Or your insurance company. It's it's just absurd
It's
as a
it's
physician and as a patient and a father that that anybody is going through this system.
yeah, it's completely absurd. It's a system that has evolved. It's a system that we have more or less grown up with. Americans don't really understand how other systems operate, and much of the information they think they know about other systems is based on propaganda from insurance company PR people like I used to be. So people have been lied to about our own system and about systems abroad, and they just can't imagine that the system can change. It can change, and it must change.
Right.
And private insurance companies will, at some point, be part of the past. They cannot continue to be playing the central role in getting coverage. Being the gatekeeper for people getting the care that people need.
Right. And, what I found striking about this woman in Boston is that this was the state that, that should have been the best and brightest when it comes to the Affordable Care Act. After all, they had Romney Care before they had Obamacare. And that's not to say that's not to tarnish the hard work that the Affordable Care Act has accomplished. If anything,
Right.
I'm very grateful for the expansions of Medicaid, and to me, I totally believe that the good work that Medicaid has done is a great reason to champion the Affordable Care Act. But aside from Medicaid, it was supposed to be Romney Care / Obamacare that was
Right.
supposed to come to the rescue of women like this 45-year-old who had an accident on the train.
You're right, and Massachusetts does have one of the best systems of health insurance in the country. Uh, Romney Care, as you well noted, was what the Affordable Care Act was based on. But still, even in Massachusetts, you have this worsening problem of people not being able to get the care that they need because of the expense. And one of the things that has become abundantly clear over the past several years is that health insurance companies cannot control cost, nor do they have any interest in controlling cost. What they have an interest in doing is passing more and more of the cost of coverage and care to their customers. And that's what we have been seeing even over the past few years after the Affordable Care Act has been passed. It has done good, as you
Right.
noted, and I've been supportive of it as well. It has made a lot of difference for a lot of people, but it's not where we need to wind up. And I said that even when the bill was passed, that that was just the end of the beginning of the
Yeah.
reform that we really need in this country.
Right. And I feel like that's actually been one of the toughest parts of having these conversations about the shortcomings of the Affordable Care Act with some of my colleagues. It feels like we are struggling to build that understanding that the Affordable Care Act, it's important, but it is insufficient. And
Right.
to just to know that, yeah, you can be a champion for protecting the Affordable Care Act in 2017, but then demand that Medicare for all be our next step.
Yes.
And I think that when I hear so much about patients who feel that they did everything right, they paid their premiums on time, that they're watching pieces of their paycheck go to an insurance company, they choose an in-network provider to get work done, and then they get the health care, and a couple of months later they end up with a hospital bill, and they're left wondering, how did this happen to me? I thought I had insurance. I thought I was supposed to be protected from having to pay these thousands of dollars.
People are under that impression that if they have coverage, that they're covered. But increasingly, that is not the case. People are finding that even with insurance, in many cases, they have no option but to file for bankruptcy. And we're the only country in the developed world where that is a fact and a reality for a lot of people. You're right. The Affordable Care Act is insufficient, and it's unsustainable. Did I lose the connection?
Yeah, no, I think we have you again.
Okay.
I think that one of the, it's, I was just having this conversation with, it was in my private life, about how, when we look at insurance, that we have to start asking these questions of where did the money go? Because as a healthcare provider, I'm more than willing to tell people that, your insurance costs 3 times more than it did in 1999 when I started medical school, but I cannot tell you that as a healthcare provider, I'm doing 3 times a better job than the people who trained me. I mean, that is simply not the case. And I think that it's interesting how we've all become the frogs in the hot water. That we've just gotten more and
Yes.
more accustomed to this heat, and I wonder how do you like help people envision that next step, that next piece that would be Medicare for all.
Well, you start by providing people with some historical perspective, just as you have done. You help people understand how their costs have increased. Not only the cost of their premiums, even if they have coverage through their employer, they're paying a higher percentage of that premium, and they're paying more out of their own pockets. So you need to help people understand what has been happening to them. It's been gradual, but when you look at it over a space of a few years, it's pretty dramatic. And then you just project that into the future and say, this is past. This is what will go on in the future unless we change it. And more people, even if they have coverage through their employer, are opting not to take it because they don't have the money to pay for it. They have to pay, like I said, more of the percentage of the premium. And if you've got house payments or student loan payments, you got to make some choices. And often the choice is not to take insurance. So, as I said earlier, the current system is not sustainable, even with the Affordable Care Act. So we've got to do something else. And we've got to do something that's much more bold. And we can look at the success of the Medicare program. It's been around for more than 50 years now. It has been a lifesaver for so many people as they age, as they get into their 60s. I can't tell you how many people that I've talked to over the past 2 years who said they were counting the days until they were eligible for Medicare. I frankly was one of them. And I'm so grateful to have to be able to say that I'm a Medicare beneficiary now. But a lot of people need to understand there's no reason why we can't expand that for the rest of the population. It makes all the sense in the world. Medicare provides care much more fairly and much more economically. There is far less waste in the Medicare program than there is in private insurance. And we need to also help people understand that they no longer will be paying premiums to a private insurance company, and help people understand where their premiums are going. A lot of the money is going into the pockets of shareholders and executives.
Right. And I think that that's been one of the challenging parts of my conversations with people about Medicare for All is that, especially when you bring up the issue of taxes and, oh, does that mean that I'm going to have to pay more in taxes? I usually respond with, I trust paying money into the tax system far more than I do paying money to an insurance company that leaves me hanging when I need them the most.
I agree with that. You have to help people have, I've referred to it as a paradigm shift in their thinking. First of all, maybe even to see that their premiums are a kind of tax. They pay to a private insurance company, and there's no accountability at the ballot box for that. There is for publicly funded health care. But we need to help people understand that they actually, most of us, we'd be paying less for coverage under a Medicare for All program than we do with our current system of private insurance. And certainly that would be the case for almost all of us as you project that out into the future.
Right. And, one of the other groups that I find a lot of hesitation with when it comes to Medicare for All is physicians. It comes as no surprise. After all, the American Medical Association was not a fan of Medicare, and going back even further than that, they were not fans of Social Security and FDR's attempts of starting a national health insurance program. But I wonder what are the things that you talk about with physicians about Medicare for All in 2017, 2018 to to get them on board and to give them the reassurance that, they can make a living, that they can practice healthcare the way that they intend to, and that it isn't this, socialized medicine nightmare that they've been led to believe?
I think it depends on whether you're talking to a primary care physician or a specialist, because often there's a divergence of opinions. I think more primary care physicians are embracing Medicare for all now than in the past. Specialists in this country make quite a bit of money, and I think they're concerned that they might not make as much money under a Medicare for all system. One of the things I tell physicians is that look at how much money you're having to pay in administrative cost just to deal with multiple insurance companies. It is an enormous amount of the revenue that they bring in their practices. That could be reduced significantly because the administrative cost of Medicare is far, far less than private insurance companies. And you could also look, and I'm sure that we would in a Medicare for all system, of what the compensation is overall for physicians, and have that being the starting place, knowing that you would have Medicare for all payments, Medicare paying for all care, but the physicians would have to pay less than they currently do for administrative coverage, administrative cost. So that's one thing. Another is that you wouldn't have the hassle of dealing with a lot of private insurance companies. One of the reasons they put up with it is because insurance companies actually do pay more than Medicare does in many cases. And one reason for that is that when you have multiple insurance companies in any given market, none of them has the ability to negotiate favorable prices. So Medicare, being as big as it is able to use its leverage to pay physicians what it believes is a fair reimbursement for care. But private insurance companies don't have that size. And so consequently, over the years, physicians have actually benefited somewhat financially, or think they have anyway, because of our multi-payer system. They don't take into consideration, though, the hassle and the cost of dealing with multiple insurance companies.
Yeah. So our audience, you're on the 0 Hour. Our guest is Mr. Wendell Potter, and we were talking about Medicare for all. I really appreciate that point about just how much hassle physicians go through with the insurance industry, because whenever I've talked to small groups of both physicians and patients, and these have always been kind of informal social situations, I like to bring up that health affairs evidence that came up a few years ago, where they found that the average American physician loses 3 weeks of every work year arguing and negotiating with the insurance industry. And it's an interesting number of time to put out there, because I ask both the physicians in the audience and the patients, what would you do with these 3 weeks? What would you want American healthcare to do with these 3 weeks? And almost inevitably, the answers are always that the physician feels that they would be seeing more patients, they would be doing continuing medical education. And because physician burnout is a real problem in America, many of them feel that they would be doing some self-care. And when the patients hear that, they feel even more supportive of the idea that that's exactly what they want their physicians to be doing. It's just that they take for granted that those 3 weeks, because just like you said, they're getting compensated higher on the other end of it.
Absolutely right. And not only could they undoubtedly see more patients with that extra 3 weeks, they might also be able to spend more time with each individual patient.
Yeah, and I think like that was actually something that, the patients reminded me, is that, it'd be great if the doctor saw more patients, or they just spent more time with me. Okay. And I think the other element of Medicare for all that I don't want to overlook is that, physicians end up arguing so much of their time with pharmacies about the cost of medication that they had just prescribed their patient. Okay. And, the amount of hassle that we go through with prior authorizations and with trying to figure out how do we get our patients a better deal for their prescriptions, Medicare for all is a great answer to that.
It absolutely is a great answer to that. And you mentioned prior authorization, and that's what happened to Natalie Sarkeesian. Her doctors were essentially having to beg for an insurance company to cover a procedure they were convinced would save Nadaline's life. So much time is spent by doctors. It's not just their staff and the nurses on their staff who are on the phone with insurance companies. Doctors themselves, as you well know, have to get involved as well in many cases. And drugs in particular are a problem, increasingly a problem as those costs go up. And we're seeing clearly that insurance companies cannot control the price of medications. So doctors are having to spend more time on the phone with pharmacists to try to get the coverage that their patients need or the drugs that patients need. I myself have experienced that myself. Even with Medicare, we have to deal with insurance companies for the pharmacy benefit, which I think is horrible. Mm-hmm. I think it should be changed. And Medicare certainly should have the ability to negotiate directly with pharmaceutical companies for drugs, because that would bring the cost down. We have a very inefficient system of drug coverage through the way it was structured back in 2003. Both insurance companies and drug companies have made many billions of dollars because of the way it was structured. So that's one thing that improved Medicare for All would do. It would give Medicare the ability to negotiate with drug companies, and that could bring the cost of drugs down and save doctors and patients a lot of hassle.
Yeah, and I think that that's actually a very interesting misconception to help unravel for people who are genuinely curious about Medicare for All, is that I usually start the conversation by telling people, well, we're talking about upgrading Medicare, that this is not the, the Medicare that we have existing right now. There are lots of little upgrades and big upgrades that we can be doing. Including how the program negotiates for drugs to cover vision and dental, which I think a lot of people are very surprised to hear that vision and dental are not covered in Medicare. And I think that little bit by little bit, when people start to understand that we're talking about upgrading a program and expanding it, I feel like I see some enthusiasm grow. But then I also feel that people look at the insurance that they have and they feel, well, this is the devil that I know. And then I feel like there are also some members of the policy debate who take the devil that we know and try to say, well, why can't we just make some adjustments and adopt the German system of sickness funds, because after all, aren't we much closer to that? And I have a lot of doubt about whether our current insurance model will ever adapt to something like what the Germans or Swiss have.
I agree with you. I think it would just be as easy, maybe even easier to go to a Medicare for All system, because it is a program that's been in place now for 50 years. It's one that we know that works, and we know that people who are enrolled in Medicare are very happy with. And why not expand that rather than trying to adapt our system or to look like the Swiss or the German system? Either way, insurance companies would have a different future. And we're not talking necessarily that insurance companies would disappear. Even with the current Medicare system, private insurance companies are often the contractors. They administer the benefits. They don't do the same work that they do for self-insured companies or for insurance companies that sell coverage directly to individuals, in that they don't require prior authorization, but they administer the benefits. It's something that Medicare contracts out. So insurance companies would not necessarily go away, but they would not be in our lives like they are now.
And, I think bringing it back to Nataline and how she faced a death panel, I feel like that is one of the elements of the insurance industry that we would be seeing go away, is that there wouldn't be this capricious life and death determining aspect of the insurance industry, but that they would have a much more routine and possibly mundane role to play.
Oh, absolutely. And I think that people don't understand just how much authority an insurance company executive has, and the role that he or she plays, and whether you get the care that you need, and how much powerful they are, more powerful than your doctor in determining the care that you need, that you will ultimately get. The other thing that I often remind people is that the two companies that I worked for over 20 years were both big for-profit health insurance companies. I worked for Humana for a few years before working for Cigna. And that medical executive who made that first call on denying that transplant for Nataline Sarkeesian, he was just as much of a corporate executive as I was. And he knew that he had a role to play in making sure that his company, our company, met Wall Street's profit expectations every quarter. So when you are in that kind of environment, you don't have to have a dictate from a superior saying you will deny X number of transplants this month. You know that you've got to do your part to make sure that the insurance company is making the numbers that Wall Street expects.
Right, and it's what I appreciate about this conversation is that we're envisioning flipping profits before patients to putting patients first, and I greatly appreciate you coming on the program to reflect on your experiences both within and outside of the insurance industry.